enter the room.
Hello, I'm Mishi Khan. I'm one of the doctors here in this department. Before we start, can you please confirm your name for me?
Yes, doctor. I'm Cassie Holland.
Okay, it's nice to see you. Is it okay if I call you Kathy?
It's Cassie, doctor. Yeah, that's fine.
Cassie, okay. Okay, Cassie, I'm sorry about that. Cassie, I can see that you're here with Timothy, right? So can you please confirm your relationship with him?
Yeah, doctor. I'm mother of him.
Can you kindly confirm Timothy's full name and age for me, please?
Yeah, sure. His name is Timothy Holland, and he's 4 months old.
Okay. So can you please tell me why did you bring him here today in the hospital? What happened
Uh,
exactly?
doctor, I'm very worried because when I was just changing his shirt, this morning, I noticed that he was crying. I noticed a swelling on his left arm as well.
So sorry about that. So can you please tell me more about the swelling on which arm does he have?
Yeah, doctor, it's his left arm where I noticed it this morning.
Okay. By any chance, did you notice that he had any fall or did he injure himself?
Doctor, when I was there, I mean, he was fine. I mean, because I was still at home last night, so but he's usually fine. Don't know what happened.
Okay. I'm sorry, I couldn't understand what you said before. You mentioned that you were not there last night with
Yeah,
Timothy?
doctor. I mean, he was fine before. Like, that's what I'm saying. And this swelling just happened suddenly. I mean, I was at home this morning because I usually work, and I was at home. I noticed the swelling, so I'm worried. What could be the cause of it?
Okay. And when you touch his arm, does he cry when he's in pain?
Yeah, he was crying a lot. I mean, he was like he never behaved like this before.
Okay, I understand. Also, Cassie, can you please tell me when you're at work, who looks after Timothy?
Yeah, doctor, my boyfriend.
Okay. And are you the so okay, so can you please tell me who else stay at home with Timothy?
Nobody, doctor. My boyfriend, he's like a very good guy. I just trust him, and I'm just like I entrust him. I just leave him with him. Leave my son with him, and that's it. Nobody else.
Okay, okay. Are you the biological parent of Timothy
Yeah, yes, exactly.
and your boyfriend?
No, doctor. He's like just my boyfriend.
Okay. And can you please tell me more about Timothy's birth history? Does he were there any was your pregnancy planned with Timothy?
Yeah, doctor. It was like planned with my past partner.
Okay. And did you had any complications during pregnancy or during birth?
No, it was absolutely normal.
And when Timothy was born, did the doctor told you that he has does he have any health conditions or any medical
No,
illnesses?
nothing at all, doctor.
And so far, is he up to date with his immunizations?
Yeah, doctor. Absolutely.
And is he eating and feeding well?
Mm-hmm. Yeah, he was. Yeah.
And is he gaining weight?
Yeah, he's like, as I mentioned, that he's absolutely normal. It's just the swelling that I'm worried for.
Okay. How is Timothy in front of your boyfriend? I mean, is he playful around him or, you know?
Oh, well, doctor, I have never noticed him being fussy around him or anything like that.
Okay. Okay. Thank you so much, Cassie, for answering all my questions. Is there anything in particular that's concerning you?
Yeah, doctor, I'm very concerned. I mean, what's happening and why his arm got swollen all of a sudden? Like, I really don't know.
Okay. So thank you so much for answering all my questions. So is it okay if I quickly go and look after Timothy and come back and discuss what has exactly happened.
Yeah,
I
that's
would like
fine.
to
Please go ahead.
examine him. Yes, okay. So is there any findings? Any other
No, doctor.
findings?
No,
What
it's
Okay.
fine. There's no.
doctor? Which
Okay.
kind?
Okay, Thunupa. So thank you so much for answering all my questions, Cassie. So we did an X-ray on Timothy, and the X-ray shows that he has a fracture in his left arm. So there's a bone which is called humerus, which is broken, and the nature of the fracture is actually quite concerning us, Cassie.
Oh my
So
God. What do you mean by that, doctor? What do you mean by fracture?
yes, yeah. So the nature of the fracture is quite it's quite we are not sure that how it gets, but usually this type of
2 minutes
fracture
remaining.
occurs when there is some sort of if the arm has been forcefully pulled or has been twisted. So because of the nature of the fracture, we are quite concerned about him. And so would you like me to discuss about the further management that we are going to do for Timothy, Cassie?
No, doctor, I mean, I'm not getting you. I mean, what do you mean by fracture and what are you trying to say that being pulled and all? I'm literally not getting it.
I completely understand that this has come up as a shock for you, and I'm really sorry about that. But yes, unfortunately, the X-ray shows that there's a fracture, which means that his bone of his left arm bone is broken. Okay,
How's that
and we
possible,
really
doctor? I mean, we normally don't take him on heights or any other places where he could be having a fracture.
yes, so we are not sure how exactly he got the fracture. So for that, what we are going to do is that we need to call the social services. So they might come and do their they might come and ask you and ask your boyfriend, and we look into things further and would be able to tell you how exactly Timothy got this fracture. Moreover, we do need to keep him in the hospital to further manage him and look after him, and we would be offering him fluids and painkillers, and we might be putting a cast around his arm. I would be calling the specialist, the bone specialist team and the pediatrics team as well to come and look after Timothy for further management. And yes, there are some leaflets which you can read and understand more about this type of fracture.
No, no, no. Wait, doctor. I mean, what do you mean by social services? I want to see my baby. He's so young.
I understand that you do need to
Move on
see
to
your
the next
baby,
station.
but we okay, thank you.
All
Sorry.
right. Thank you so much, Maria. That was great. That was great acting.
Yeah, it was good.
There's a lot coming up though, but time was up.
Yeah, that's good. That's good. I mean, especially when you are simulating the case, you understand so much of
Yeah, I
you.
mean, I mean, Dr. Mishra, I would say just like, try to engage the mother as well when you're talking, because I was like, you're just talking, give you a leaflet, we will do this and manage her, but you're not giving her a chance to speak anything. Because I wanted to speak a lot of stuff,
Understand.
but I didn't got a chance.
Yeah.
Right. Actually, I just saw the time and I was like, okay, I'm running out of time, so I should like quickly speak up my part but
I
I know I
know,
completely agree. I do wanted to keep you engaged in
because it's
all
like a
of the
non-accidental injury.
questioning.
You should have explored my
Right, right,
boyfriend or mentioned about that as well, you know.
right, right,
Yeah.
Absolutely,
right.
I completely agree with Dr. Javeria's point over there. But I think I can see Dr. Mishi's side of things as well because she wanted to quickly bring in the leaflet aspect, but then she had such less time by the time she reached management itself. So you had only less than 2 minutes, I think, when you reached
Yeah,
Absolutely.
actually comes to such a case, there is a lot to do in management. So your history taking needs to be a little more shorter. So even
Yeah.
from the
right.
that you have taken, I would want to ask you a few questions. Like, who witnessed the injury? Who witnessed anything that what could have happened to the child?
So the mother witnessed the injury. She was not, she saw it all of a sudden. She did not witness any fall, nothing. She was just changing the clothes, and then all of a sudden she noticed a swelling.
All right, so she
So,
witnessed the swelling in the morning, but there wasn't any fall or anything, right?
yeah,
So
right.
was the child before that?
Right.
Right? Like,
Yeah.
what happened? Like, what happened to him? Like, how was he the night before? Was there any problems?
That's why I was like giving a hint as well that I wasn't at home. I was at work, and I don't know. He's fine
Yeah, so
usually.
I just kind of cleared that out, and then then she said, yeah, my when I asked, okay, when you're at work, who looks after him? So she
No, no, no.
said
What I'm
boyfriend.
trying to say is, if this is the right, if this is the presentation of the child at the moment, right? If the
Yeah, I
child,
should have asked. Did you ask your boyfriend about how about Timothy's swelling? Like, how did he get it? About like, yeah,
right?
maybe.
Mm.
Yeah, I
So
should have.
I'll just want to explain my point out there. So at this point, you have seen that this was the first time that the mother saw the presentation, right? So before that, whenever she met the child last, did he have it? And then you can go on to asking the question, when was the last time you saw the child?
Okay.
All right, because it's very unusual. So then to bring out the point that this happened at a point where, she was not with the child. So you need to ask the presentation, like at the moment you saw the child when? In the morning when he came with the swelling, right? So before that, when did you see the child and was he okay? All
Okay.
right, to see if there was any absentee period. So because at this point she also doesn't know what has happened, right? So you need to understand, was there any absentee period where the child wasn't with the mother, where it could have happened? So current history and any past presentation, like when have you seen this from? How long has this been there? She'll say just this morning. All right. So when was the last time you saw the child? Say that, yeah, probably in the evening. It's like, who was there in between that period? Do you understand? So you're trying to bring about the sequence of events, and you do not know the sequence of events at this point. You just know that this was first presentation. Mother also saw it for the first time. And at that time when the presentation happened, there was no injury, there was no signs of injury. So you need to understand, where could the injury have happened, right? And what is the thing about spiral fractures? Like, you did mention that the nature of this, like, what are you trying to say? Like, what is the nature? Like, what do you mean, what do you understand by spiral fractures?
So,
Any okay, yeah, just go ahead, Dr. Mishi.
so spiral fractures are usually, when someone is like, kind of pulling the arm or twisting it. It's like a so the nature of the fracture is not, something that a child can get this type of fracture if he might had a fall.
All
It's
right, so
very
you
kind of
mentioned
unlike.
like you
Yeah.
mentioned as the name suggests, it's a spiral fracture. So it will be a helical. The fracture line will be kind of spiral, like a corkscrew shape. And this is usually not seen in falls. And this is actually seen when the hand is, or any long bone is twisted. All right.
Right.
Like at this age, children's bones are very pliable. And this kind of a fracture only happens in children. Right. So only usually, even if you see like a fall kind of a fracture, if at all you see a hairline fracture, it would never be helical, the fracture line. In these cases, you'll actually see a spiral kind of a, fracture line itself, which exactly is what is more, what is, significant of any non-accidental injury. So that's why you're talking about the nature of fracture. Given this kind of fracture, it's usually not seen in any accidents, right? It's usually seen when, any bone has been twisted, right? And then speak about why you think. So once you manage to elicit the time of the, so at this point in this entire conversation, you were not able to elicit the time of the injury, which is very important. At this point, you're in the dark, the mother's also in the dark. So to call on social service is going to be a very difficult thing, because you haven't even tried to convince the mother that this could have been a non-accidental injury. You managed to talk about the boyfriend, but she said he was loving and all that. So you've never managed to elicit the fact that there was a period without her supervision that this could have happened.
Okay.
Right. At this point, nobody knows the history, but we are suspecting something, something really in the terms of abuse, and that's why you're trying to bring in a social service. So you have to give an indication that, you know, your child most of the times. Okay, another thing, why does the child have to be with the boyfriend, right? Like what does the mother do at this point? Do you know what the mother does?
No.
Yeah, that's what. How much of period of absence is going to be there in this child's life? Like how often are you not around the child? That's also a very important history. Why does she have to leave him with the boyfriend in the first place?
Right.
Right. So this is understanding, like usually like for a 4-month-old child, most of the times the mother is going to constantly be around the child. What are the different reasons why the mother needs to be away from the child? You need to explore that. Like, is there any financial strains? Is she working? Right? Why does the child have to be alone with the boyfriend in the first place? What does the boyfriend do? Why doesn't the boyfriend go for work? Right. So understand the situation of the family a little bit more before you're introducing, you know, non-accidental injuries. So you need to at this your data gathering. You were trying to get to the data gathering, but ultimately your data gathering needs to be like in such a way that it makes a comprehensive picture of the event that could have taken place. So at this point, we are also in the dark about what could have happened and any potential, you know, causes for involving the social services. Apart from the spiral fracture, you couldn't elicit any of the potential dangers that the child might have been in, right? So the absentee parent is also very big. No biological parent around the child, you know, that's also major. Is the boyfriend known to the police for any reason? Does he have any criminal past? Right. So you're trying to bring out any kind of red flags in the parenting at this moment, right? Before you actually involve social service, because this will be, you know, imagine actually telling a mother about involving social service just for a, you know, injury that they didn't even witness. So it can go into a very wrong direction. And before you even bring in the social service, you should try bringing in your seniors. That's very important, because any case that you're going to be involving social service or is going to be a major incident on the hospital, you need to first run it by the senior.
Right.
You should suggest that we are going to keep you in the hospital, and most probably we're going to be involving the social service, because it's not your call, it's always the senior's call, especially when it comes to such situations, right? Only after the senior reviews the case, then only will they actually make the call to social service. So always mention the senior first and say that there is going to be a high likelihood of getting social service involved and what they could possibly do. All right, let's quickly look at the performance. Dr. Sana, were you able to mark?
Yes, I have submitted.
Awesome. Thank you. All right, let's look at that. Okay. Confirm the child's full name, age at the start of the consultation. Confirm the mother's identity and the relationship with the child. Ask for details of the swelling, when it started and whether it increased, whether it's increasing or associated with pain. Explore the mechanism of injury, whether Timothy fell or sustained trauma. Ask who was supervising Timothy when the swelling or the injury was first noticed. That's also a good thing, because when was the first time you noticed? It was early in this morning. Did you notice it the previous night? Right? Did he still have it just one day before or a few hours before? Right? Inquire about family dynamics, the home environment, and Connor's relationship. So the boyfriend's name is Connor, by the way, and Connor's relationship with Timothy, and if any relationship with the biological father. Ask about yeah, you asked this, right? Ask about Timothy's past medical. You also, you know, if you know that Connor is at this moment taking care of the child, Timothy, you know, and he's not the biological father, is there any interaction with the biological father? Right? Because if usually the biological father is also in touch with the child, they would have also noticed this. Is the biological father also taking care of the child? That's also very important. At this point, who all are involved in the care of the child? Right? Ask about Timothy's past medical history, including birth history, vaccination, any developmental delays or previous injuries. Clarify boyfriend's involvement, what exactly he observed, and how long has he been in the mother's life, right? Ask about Timothy's behavior, any recent changes or withdrawal, irritability, sleep disturbance, or fearfulness. Yes, you ask this, especially when he sees your the boyfriend. Yeah. Clarify the event of previous night and any observation made by Connor. Explore the possibility of non-accidental injury by stating the unusual nature of a spinal fracture, and sensitively ask about any history of aggressive or violence in the house, right? So I wouldn't give 3 for this. I'll probably give actually I'll actually be giving a 1 or a 2, because there was a lot of things that you needed to ask, to get the history out. So there were a lot of history relevant history that was missed. You ended up asking a lot of history that was not very relevant to this case, like pregnancy, vaccination history. At this point, it's not really that important because it doesn't help you in management. You're supposed to get to the bottom of what has happened, right? That is the main idea of this case. All right, management. Explain the X-ray finding a spiral fracture is present and is concerning due to the mechanism needed to cause it. Gently explain the nature of spiral fracture and the high impact required to cause it. Inform the mother that hospital admission is necessary for monitoring and care. So at this point, when such a decision has happened, when such a diagnosis has been made, you will not be sending the mother home at all. You'll keep the mother in the hospital until, of course, the required arrangements have been made, until social services has come and had a chance to talk with them. Yeah. Ensure appropriate pain relief is provided to Timothy immediately. Arrange for orthopedic review to determine the best treatment, cast versus surgery. Explain social service will conduct an assessment to determine Timothy's safety and family needs. Discuss the need to rule out non-accidental injury. Inform Cassie about the fracture and its seriousness. Clearly state that due to the injury type, you are legally required to inform social services for safeguarding. Reassure the mother that social services are there to support the family, not to blame. Provide written material, leaflets, pamphlet explaining the spinal fracture and social services process. Reassure Cassie about the primary goal is Timothy's safety and well-being. Arrange a follow-up appointment in 2 weeks to review Timothy's recovery and any ongoing support needed. Ensure throughout documentation of all history and findings and steps taken in the case.
So I have a doubt.
Go ahead, Dr. Mishi.
So after we manage Timothy in the hospital, are we sending him back with the mother?
No, we are not sending him back, especially because it's a social service case. Until social service,
Exactly.
you're not sending him back. That's why
Exactly. So I'm confused about the follow-up thing then.
Oh, yeah, good question, definitely. So this will be reviewed by the social service. The social service won't be taking away the child. They'll be reviewing the safety of the child. So they'll be making sure that if the child has to go back to the parent, that the scene is safe, that he is not in any immediate danger. So that is also one of the questions that the mother also asked. Involve the social service, will they take away my child? That's not always the case, right? So at this point, you can't even comment on the fact that, the social service will come and take away the child, right? So you're going to be hopeful because, saying the same thing to the mother, reassuring the mother that this is important, especially since Timothy's health and safety is our primary concern. And at this point, only after social services assessment can we forward with, sending you home. But definitely, if the mother is going to whoever the child ends up being, most probably the mother itself, you will be arranging a follow-up for the injury that has happened, no matter where he is, right? So you can reassure the mother saying that we will be following up with Timothy on his fracture in a few days to see how well it's recovering. Right. So that's no reason not to arrange a follow-up. You'll still be mentioning the idea of follow-up. Yeah? Does that answer your question?
Okay, yes, it does.
Awesome. All right. Validate Cassie's concern and allow her to express concerns and ask questions. Use simple. So the only time when she'll be asking questions, this mother will be only asking questions in a more worried way when you actually talk to her in management. Your management, basically, you had barely 2 minutes. So these are cases where management would be more than 4 minutes. Data gathering, history taking, keep it short. Try to understand the event, the sequence of event. Once you've done that, move on to management because you have a lot to talk in management there. Yeah. All right. And then show understanding, compassion for her anxiety and agitation. See, these are all most of the points that you can elicit in interpersonal skills only comes when you're actually giving management, right? When you're actually talking to her about the fact that you're going to be calling on social services. That's when all the anxiety, worry, and all of that comes in. So you have your interpersonal skills, how you actually tackle those questions comes out then. So you'll be marked for interpersonal skills mainly there. Yeah. Signposts explain each step of the consultation and what will happen next. Offer tissue and comfort if Cassie becomes distressed. Be patient and give her time to absorb the information, summarize the discussion, and reassure Cassie of the steps being taken for Timothy's care.
Okay.
All right. So
Okay.
that finishes our last case for today. Thank you so much, everybody, for joining. If you guys are not already a part of our WhatsApp group, please do join our WhatsApp group. We will be posting any scheduled classes or any scheduled discussions on it. And also, if there are any questions you guys would like us to answer, do let us know in the WhatsApp group, and we will make answers in the form of blogs that you can access at any time. So, well, again, thank you everybody for joining. And if you are interested in purchasing our workbench, which is the app that we have built and are using to conduct these practice sessions, you will be eligible for a 20% discount. So we'll just be quickly posting the 20% discount coupon if you're interested. And we have a few free cases that you can try out and practice with the simulator, which is the AI, patient AI. So do check that out and let us know how it goes. So thank you everyone again for joining and have a nice day.